A person undergoes a surgical treatment for a health problem. He becomes absolutely normal for few months. Later on, once again, the same problem comes back. He will definitely be upset. Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today, we are going to see an important patient. This patient came to me with the history of cataract surgery undergone for cataract, that is decreased vision. He was normal for some time, but later on his vision once again started decreasing. Now his vision is not clear. When I saw the patient, at the first look, his eyes were looking normal. His eyes had a glistening reflex. I was able to see the scar, that is scar after a cataract surgery. And when I examined the patient's vision was not normal. It was very, very low. When I very closely observed this patient, I was able to see that behind that glistening reflex, inside the pupillary area, there was a whitish sheet-like opacity, whitish or grayish-white sheet-like opacity. This case can be kept in the examination for undergraduates, either in the long case or short case. This is called as after cataract, a cataract developing after a cataract surgery. The other name for it is posterior capsular opacification. What is this posterior capsular opacification or after cataract? Here I have drawn three pictures. One is a normal lens which has developed a cataract. You can see that the light rays are not able to pass through that lens, causing decreased vision. Patient has undergone a cataract surgery. In the cataract surgery, what we do is we make an opening in the anterior capsule of the lens. We remove all the lens fibers and nucleus which are cataractous. Everything has been removed. We place the intraocular lens which is drawn in green color inside that. Once we do that, what happens? The light rays can freely pass through it and fall in our retina, giving us a very good vision. In all these three pictures, you can see that in the anterior capsule, I have drawn some cells. You can see here, I have drawn in blue color. There are some cells being drawn. This is called as the lens epithelium. This lens epithelium is the cell that is continuously forming lens fibers inside our normal lens. During cataract surgery, we remove only the central portion of the anterior capsule. Because of that, this lens epithelium will be still there in the periphery of the anterior capsule. This lens epithelium has the capacity to reform the lens fibers throughout the lifetime. This lens epithelium, even after doing a cataract surgery, they start to form new lens fibers. These lens fibers, because there is no support on the anterior surface of the lens, they grow along the posterior capsule of the lens. You can see here in the third picture, they grow along the posterior capsule of the lens. Sometimes it may become very thick, obstructing the light rays passing through it and falling on the retina, reducing the vision. This lens fibers which are formed after cataract surgery, they will not be clear. Why they are not clear? Because unlike a normal lens, this capsule is open. So whatever aqueous humor is there in our eye, that will also pass around this IOL, in which these lens fibers will be immersed and soaked. So these lens fibers, they get opaque and they become cataractous lens fibers. So a cataract developing after a cataract surgery is called as after cataract, because it is developing along the posterior capsule. It is called as posterior capsular opacification. In short, after cataract is nothing but a failed attempt by the lens epithelium to reform the lens. After cataract is of two types, that is Elsnick's pearl and Soemmerring's ring. So Elsnick pearls, they appear whitish, bunch of grape-like appearance behind the glistening reflex, that is behind the IOL. Soemmerring's ring, you'll have a ring-shaped whitish opacity, and in the center portion there will be a thin sheet of opacity. The treatment for after cataract is neodymium, yttrium, aluminium, garnet laser. That is ND-YAG laser. When this laser rays are applied to this after cataract, it will cause photo disruption of this capsule, so that opening is created. Opening is created here. Opening is created here, so that these rays can pass now and fall on the retina, giving back the vision. So this is the treatment for after cataract. For this, nobody needs to get admitted. This is a simple procedure which can be done as a OPD treatment. You can walk into the doctor's clinic, you can get this treatment and come back with the eye drops which has to be applied for few days. After that, you will become absolutely normal. Now, you may ask a question: is there any treatment to prevent the formation of after cataract? Definitely it is there, but it is not done for everyone. It is done for childhood cataract. For a small child getting a cataract due to various reasons, or a patient who is very, very young. Why we have to do the prophylactic treatment in those people? In those people, this epithelium of the lens will be very, very active, and definitely this epithelium will form a large number of fibers that grows along the posterior capsule, leading to a very, very thick after cataract. If there is a very, very thick after cataract or posterior capsular opacification developing, It is very, very difficult to do a ND-YAG laser capsulotomy. The laser may not disrupt the very thick opacity in young people. In order to prevent after cataract formation in young people, we have to do anterior capsulotomy. We normally do in any cataract surgeries. Along with that, we also create a opening in the posterior capsule, that is the center of the posterior capsule, so that even after a surgery, these fibers, even if they get formed, they cannot have a hold to grow along the posterior capsule and thereby not obstructing the vision, so that patient will have a very good vision after a cataract surgery always. With this, I am going to stop here. We will see with some other case that can be kept in examination in the next video. Thank you.